my name is Amy Sturkey. I am a pediatric physical therapist, and I'm here today to talk about something tricky. We've talked about how poop and pee accidents are caused by constipation. And I said that in this video, I'd talk about how do you deal with constipation. Well, that's a really tricky subject. The first thing I want to say is really important to handle constipation problems early. If your child has been potty trained and for at least 6 months and starts having bedwetting accidents during at night or pee accidents during the day, then that's a problem. You need to start handling it. The research says that the longer the constipation goes on, the harder it is to manage. So don't delay. Go ahead and get started. The other thing is that when you go to doctors, often doctors will undertreat constipation. They will recommend increasing fiber or with gummies, or to start eating more vegetables or more fruit, or throwing out dairy. Now, all these are good recommendations, but the research indicates that changing your diet doesn't change constipation. Increasing liquid does not change constipation. So I think those are well-meaning doctors, but often constipation is undertreated, and this encourages this problem to go on a lot longer. So the first thing I recommend is don't just watch this video. Find a therapist or a doctor who specializes in this area to be able to help your child. So the things that you should do first is get an X-ray to confirm that constipation is causing the problem. And the doctor needs to know how to do that X-ray to be able to measure the rectum to see if it is in fact enlarged, to confirm that constipation is the problem. And the other thing is that when you try a treatment, you want to make sure it's working. So you need to go back after a month to see that the constipation is improving over time. Because sometimes people stay with the same regimen over a time and don't see changes, and then they think that nothing works for their child. Nothing works means that you should have changed a long time ago. So what does work? The research says that after 3 months of Miralax, that's like PEG treatment, 30% of children stopped bedwetting. But if you treat with an enema, 85% of those children after 3 months, their constipation and bedwetting had improved. So there's really only 2 effective treatments for constipation. One is enemas or liquid glycerin suppositories. Those work. And the other things is oral stimulant laxatives or stimulant laxatives like X-Lax or Senna syrup. The problem with those 2 options, the X-Lax, those work in 5 to 10 hours, whereas an enema works in 5 to 10 minutes. So if you try the X-Lax option, then the timing can be tricky because you don't know what you're going to be doing in 5 to 10 hours, more than likely. And if you think about it, the more direct treatment for the problem is right at where the problem is, not through the mouth, but right there at your rectum where the problem is. So you're more likely to have better results if you deal with the problem directly. The other thing I want to say is if you try the laxative treatment and you're having soiling problems, then the soiling problems are going to get worse, not better, because now you're encouraging your body to send out poop, and it's going to go around that hardened poop that's there causing the constipation. So your problem's actually going to get worse first. So again, the better option is enemas, although it's probably the one that you don't want to hear is the best option. Just remember that poop and pee accidents are hard to treat. However, if you're just having poop accidents, these problems, if you address them directly, they usually improve within a month. But if you're having pee accidents at night or during the day, this can take a lot longer for this problem to fix. The biggest thing I want to say is if you're having poop or pee accidents, don't delay. The longer you hold on to this problem, the longer you hold on to the problem, the worse the problem is. And you want to find a local professional who can help you. There are some doctors such as Stephen Hodges, that will give consultation by video to be able to help you. Even if he's not local, he can help you. I hope this is helpful, and we'll look forward to seeing you next time. Thanks a lot. Bye-bye. If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.